Hello, my name is Savannah Steele, and this is my project on an extreme makeover for Nursing 713, Organizational and Systems Leadership for the Advanced Practice Nurse. This is a table of content that you can take a glance at. So our learning objectives for this presentation are to identify miscommunication in the workplace, relate conversation to culture, discuss conversation themes and how culture is portrayed, discuss patterns of meaning and relating, explain ways of talking, listening, and being, and recognize barriers to innovation. The goal from our organization is to transform into an organization of conversation with a push for innovation. So here's an example of miscommunication in the workplace. One night, I was working in the ER when we had a young Hispanic patient check in for abdominal pain. All of the normal labs, urinalysis, and CT of the abdomen and pelvis was ordered for this patient. The patient was diagnosed with a urinary tract infection. In the hospital where I work, the only available option for interpreter services at night is a computer system called Marty. Well, Marty was down that night, and no one on our shift spoke Spanish. The patient had a family member with her that said she could interpret, so we used the family member to translate, and the patient was discharged with a prescription for antibiotics. A few days later, the patient checked back into the ER with the same symptoms. This time, Marty was utilized, and it was determined the patient did not have her prescription filled and therefore had not been taking her prescribed medications. So, how did this miscommunication occur? Failure for equipment to work properly, a language barrier, lack of purposeful listening and ways of talking, and lack of time and resources on night shift. So Marty didn't work, the patient did not speak English, and the nurses didn't speak Spanish, and on day shift, interpreters are available in person, but on night shift, this isn't an option. So conversation themes, some things that you would hear nurses talking about, say, in the cafeteria. Unsafe nurse-patient ratios, not enough paid time off, pay is not competitive, nursing shortages, there's better benefits at different hospitals, doctors talking down to nurses, and the talk of pursuing higher education to get away from bedside nursing. Culture portrayed by conversations. This is feeling overworked, not valued, unheard, and all of this leads to lack of innovation. It all just adds up. Organization is conversation. So an organization is a temporary stabilization of themes and habits that's purpose is to organize the experience of being together locally and in the present. Organizations are places where human relating can create stability and potential for transformation. And here's a quote from the book: if leadership does not reside in the realm of planning, command and control, or otherwise exerting power to affect change in the system, what is the role of the leaders? So organization is conversation. There is more to organizations than just following steps outlined in policies and protocols. Leadership is relationship driven and enacted in participation with others and in daily interactions. So patterns of meaning versus patterns of relating. Meaning, that can be an organization's mission and values. Relating is interacting. So do we have a plan to resolve staffing shortages? People are leaving and going to different hospitals. They're going back to school for a higher education. Why is no one asking why? Do nurses have a say-so in anything? And then relational leading. This relates to collaboration and a horizontal way of thinking and decision making. Moving on to patterns of relating. The role of the leader is to be present and relate with others. It involves how people interact with other people and forms the organizational culture. Relational leading puts an emphasis on collaboration, empowerment, dialogue, horizontal decision-making, sharing, distribution, network, continuous learning, and connectivity. Patterns of meaning. These are specific themes in an organization. Themes for a pattern of meaning which shape the organization, and an example would be a mission and vision statement. Ways of talking, listening, and being. So talking, this is way of speaking in organizations. It involves patterns that can stabilize and reinforce culture. Conversations can be a chance for innovation and change. It's an opportunity to take up new languages and new ways of speaking that are more meaningful. Listening. Paying attention is important in collaborative communication, and an emphasis can be put on listening between the words. That can be just as important as listening to the words. And then being. The definition of mindfulness is the energy of being aware and awake in the present moment. To be mindful is to be present and at one with those around you and with what you are doing. So basically, how do we make best use of language? Innovation. Innovation involves a significant positive change. It is a concrete solution to a problem that is adopted by others. It is a process of change with involving novelty, originality, transformation, upheaval, and breakthrough. Steps to innovation. So first we need to recognize the need for change. This is at a societal level. What needs to be done? That is what we're going to look at next. And then the final step is the process of change. So we have to look at what's going to be sustainable. Typical research process includes a pilot phase, research grant, conducting the research, and publishing the results, which can take anywhere from 5 to 10 years. So can a society recognize a problem cannot be solved using an old method? This is important. And also establishing change from junk. What is the role of the practitioner in this? So change is difficult. Individuals don't want to change, especially in a big way. So they have to be made aware that the old ways are not working, and you have to be able to see the need for this to be sustainable. Changing the story. Organization is conversation. So we are going to exemplify the organization's mission, vision, and values in conversation, meaning, and relating, and encourage horizontal communication. Relating to the patient and patterns of relating. So an example would be, how would I feel if I was in a foreign country, Mexico for example, and needed medical attention? I don't speak Spanish, so looking at it from the patient perspective, I think I would feel scared, anxious, and nervous. Patterns of meaning. So the mission for my organization is to provide high quality care and services that will improve the health of those we serve. The vision, to be one of the best health systems in America and consistently strive to provide clinical and service excellence. Values, integrity, excellence, innovation, accountability, compassion, and safety. So changing the story by talking, listening, and being. Talking. This is information by speech, body language, and gestures. And it involves verbal and nonverbal cues that assist in building nurse-patient rapport. So by recognizing cues, nurses can determine and have a better understanding of what the patient is really trying to express. An example of nonverbal cues is a patient avoiding eye contact with you. This could mean that they're either hiding something or nervous about a situation. Maybe they don't want to talk about something, or maybe there's something that they're scared to bring up. So we would need to investigate further. Listening. In order to listen, nurses must compartmentalize their own feelings and try to understand from the perspective of the patient. So what might this patient be thinking right now? And then being. This involves honesty and openness, accepting positive criticism, owning mistakes and making amends, and avoiding errors in the future. Having a positive self-image builds your confidence. And then having empathy. Patients can sometimes get impressions that nurses really care about the patient and their health care, and that makes a difference in the nurse-patient rapport. And it also promotes healing. So this goes back to doing no harm. And good communication skills also help healthcare workers to better the quality of care that we deliver to our patients daily. Changing the story innovation. So some examples in our story are paying for nurses to learn Spanish since it is commonly spoken in the U.S. An example would be using Rosetta Stone to teach multiple people Spanish. Getting more IT support and providing interpreters on night shifts in the weekend because they are needed on all shifts, not just on day shift. So, X-Treme Makeover. Let's rewrite the story. One night I was working in the ER when we had a young Hispanic patient check in for abdominal pain. All of the normal labs, urinalysis, and CT was ordered on the patient. The patient was diagnosed with a urinary tract infection. The patient was to receive the first dose of antibiotics in the ER and then discharged with instructions and a prescription for more antibiotics to be taken. A family member was at bedside, but hospital policy is to not use family members as interpreters because patient information can be missed or misinterpreted. Marty, the online interpreter computer, was not working, so IT was called and the system was troubleshooted. IT was able to find a solution to the problem, and Marty was able to be utilized for the patient's care and discharge instructions. The patient understood and was able to leave, have her prescription filled, and take her prescription antibiotics. Because time was taken to find a solution for the problem and listen to the patient had better outcomes and a readmission to the ER was avoided. And here are the references that I used. Thank you for listening to my presentation.